Okay, sorry about that. Kind of got cut off a little bit there in that last video. So let's finish this up with these last few slides just about Parkinson's disease, okay? Parkinson's disease, of course, is very popular. It's very well known because of people like Michael J. Fox and Muhammad Ali that have had it. And it, of course, is a degenerative disorder, as in the brain degenerates, it gets worse, and in that part of the basal ganglia, what is happening is that you are losing this part of the basal ganglia called the substantia nigra. Well, what that does is it produces dopamine in that area, or produces the neurons, I guess, for dopamine in that area. So what's happening here is without that dopamine, that's the main problem, that neurotransmitter dopamine. So if you do not have the dopamine available, then it leads to the symptoms that we're familiar with Parkinson's, okay? So you get they call it hypertonia, as in you get too much tone, as in tremor, so things start shaking and getting very rigid because there's too much tone, okay? And akinesia, where is not being able to move. All right, and we'll see where that's apparent here down in the signs and symptoms. So that's what's happening. Okay, so you're destroying part of your brain in the basal ganglia, and typically you are seeing this, more often males than females. And typically you're talking your onset more than 40, somewhere in the around 60 years old is when you tend to see the peak cases of new incidents of Parkinson's disease. Okay, I believe that Michael J. Fox was actually a lot younger, or right at 40 when he got it. I think he was actually younger than that. Okay, so what are the symptoms that we were talking about? Okay, the resting tremor. That's where you're just literally sitting there and just shaking. Okay, so that's a little tremor. And you see it a lot like in the hands. Well, somebody would just be sitting there and their hands would just kind of be shaking. They call it pill rolling sometimes with the fingers. And what that is it's obviously kind of hard to explain. Actually, I can do this and kind of roll my fingers, right? Like pill rolling. It's kind of like they're rolling something, I don't know, in their fingers. Okay, so that's another thing. Rigidity, again, these Parkinson's patients are very rigid. They are stiff. They can't really move very well. For the bradykinesia and akinesia, as is the shuffling gait, as in another, you have videos that will show you, if you want to go back to the regular PowerPoint that was posted and look on that, you'll see the different videos on those. But again, bradykinesia, Brady is more slow moving, and akinesia is not moving at all. But what we're seeing in those things is they have what you call difficulty starting. So when they start to try to walk, they have difficulty starting to walk, but then when they try to stop, they have difficulty stopping too. So that's why they get that, what they call the shuffling gait, where they put their little feet together, not little feet necessarily, but they put their feet together and they kind of shuffle. They don't pick them up. They just kind of scooch one to the other right across the floor, okay? And another thing is stooped posture, they say. And we'll see that again. Actually, we'll see most of these on the next slide, where the person is kind of over, like they're stooped. They're not standing straight up. They're leaning forward, okay? And of course, disequilibrium kind of goes with that stoop posture, as in it's very difficult for them to get their balance. Okay, and muffled, slurred speech and diminished facial expression are both part of this Parkinson's disease signs and symptoms, where again it's all about the movement disorders. And with speech, there are quite a few muscles that have to move correctly, so you start seeing a lot of problems with being able to articulate words correctly, because of the muscles are not working correctly because of that, again, decrease in dopamine. The diminished facial expression is the same thing. So, I mean, again, many small muscles and facial expressions, as well as in the tongue for speaking. Okay, and dementia, of course. Usually you're seeing it with patients over 70, but you can certainly see it in Parkinson's at any age where, again, it's just dementia, you know, the difficulty concentrating or just being out of it, I suppose. Okay. These are our clinical features. Again, if you look at the stooped posture of this patient, you know, then you can see where she's leaning forward in a stooped posture, head bent forward. You get the tremors of the head where you get the shaking kind of back and forth a little bit with that rhythmic shaking. They call it a mask-like facial expression sometimes. Okay, we call it on the other thing, I think, diminished facial expressions or rigid facial expressions, something like that. But again, there's a lot of small muscles in the face as it is for eating, and it's very difficult to make the fine facial expressions that we're used to seeing people have, and that's also the same for the reason why they are drooling. Okay, they're just not being able to keep the saliva in their mouth because of the muscle loss, or the not the muscle loss, but the inability to control muscle correctly and keep it from contracting. Don't know that I necessarily need to go down this list. I mean, it's the same, you know, drooling, rigidity, stoop posture, weight loss. Again, you're going to get that with all these dementias as far as weight loss goes, but this especially because it is a muscle issue. Okay, akinesia, again, absence or poverty of normal movement. They tremor, they get that pill rolling movement in their hands, the loss of postural reflexes. So it's difficult for some of these reflexes here. Bone mineralization or demineralization, the bone starts, a little bit of osteoporosis going on in there. Shuffling and propulsive gait, again, you know, little shuffling walk. These feet don't leave the floor, and then when they do get going, because you're kind of leaned forward in this whole posture problem, then they say it's a propulsive gait. You kind of lean forward and just kind of like you're falling the whole way. Okay, and of course here's on the other side of the chart here is management. Again, I don't know that there's anything necessarily that you probably couldn't figure out anyway. Yeah, that's about it. I really can't see anything special on that I would have to really explain. Okay, and this is, of course, the part of the brain. If you notice, it's right smack in the middle of the brain. It's right there in the basal ganglia, and it's right there in the basal ganglia, and the substantia nigra part of the basal ganglia is, of course, what's outlined right here. And in one case, or in this case, you know, it's a lot bigger and fuller, and then it starts getting decreased in Parkinson's. Okay, so not sure what else to add about that, and that is the end of my 10.